Assalamu alaikum. Bismillahirrahmanirrahim. In this video, we will discuss how to present history of a gynecological patient. In the last videos, we had discussed how to take history of a gynecological patient and OBS patient, and now we are going to present it. First of all, introduction. My patient Shamim, my wife of Abdurrahman, 55 years old, not having any formal education, housewife, married for 33 years, para for last childbirth 19 years ago, m- menopausal for 6 years, resident of Melsi, admitted in Gynae Ward 1 through outpatient department on 31st May 2023 with presenting complaint of bleeding per vagina for last 3 months. And now history of presenting illness. My patient postmenopausal for last 6 years was in usual state of health 3 months back when she developed the complaint of postmenopausal bleeding. Bleeding is usually mild and dark red in color, for which she uses 2 sanitary pads per day. No clots are seen on pads. She experiences such episodes of bleeding 2 to 3 times per week. She has no coital activity for last 3 to 4 months. She has history of insertion of intrauterine device 8 years ago, which was removed after 21 days due to complaint of pain and pervaginal bleeding. She has no history of yellowish discoloration of eyes, bleeding from gums or mouth, chronic cough, lower abdominal pain, abdominal mass, vaginal discharge, or any mass coming out of vagina. No history of respiratory difficulty, fatigue, restlessness, altered urinary and bowel habits. The patient first visited Dr. Rubina in Melsi 1 week ago when she was investigated with ultrasonography, blood test, and pap smear. And pap smear was advised, for which she was referred to Bahawal Victoria Hospital. Medication was also given in the form of tablets to control bleeding. Here in Bahawal Victoria Hospital, she has been investigated with ultrasound, blood tests, and X-ray chest, and vaginal examination has also been done. Next plan is to take sample for pap smear. In the past gynecological history, she had menarche at the age of 12 years. She had regular menstrual cycle with average blood flow. She used to bleed for 5 to 7 days every 30 days with no complaints of dysmenorrhea, dyspareunia, intermenstrual bleeding, and postcoital bleeding. Pap smear was never taken. Past obstetrical history. She is para 4, married for 33 years. First child was male, 31 years, delivered through spontaneous vaginal delivery on full term. Second child was also male, 29 years old, delivered through spontaneous vaginal delivery on full term. Third child is female, 25 years old, delivered through spontaneous vaginal delivery on full term. Fourth child is 18 years old, delivered through spontaneous vaginal delivery on full term. All children are fully vaccinated, breastfed, and she faced no complications during and after any pregnancy. Past medical and surgical history. She has no history of hypertension, diabetes, asthma, ischemic heart disease. tuberculosis, breast, uterine, cervical, and colorectal carcinoma. There is no history of appendectomy, cholecystectomy, laparotomy, and thyroid surgery. In the family history, there is no family history of hypertension, diabetes, asthma, ischemic heart disease, TB, breast, uterine, and colorectal carcinoma. First, we have to present there is history of cervical cancer in her sister 3 years ago, for which she was operated and cured. And then we have to describe the negative finding, that is there is no family history of hypertension, diabetes, etc. And next, personal history. She is non-smoker, non-addict, having normal sleep, appetite, bladder and bowel habits. Socioeconomic history. She belongs to lower class and her husband is laborer. There are 7 family members living in 2 rooms with 2 earning persons. In the examination, an old age, normal, healthy looking woman lying comfortably on the bed, well oriented, having vitals of pulse 76 beats per minute, respiratory rate 32 per minute, afebrile, or you can say tell here the temperature, afebrile to touch, blood pressure was 130 by 80 millimeters of mercury. She is having pallor with jaundice, no clubbing, cyanosis, and pedal edema. Lymph nodes and thyroid not palpable. On respiratory system examination, trachea is central with normal vesicular breathing and equal air entry on both sides. On CVS examination, S1 and S2 with no added sounds were audible with no appreciable murmurs. Or you can tell here heart sounds with no added sounds were audible with no appreciable murmurs. Bilateral breast examination reveals no abnormality. On inspection, my patient is having flat abdomen, central inverted umbilicus, moving with respiration, and no visible scar marks and prominent veins. Hernial orifices intact, inguinal lymph nodes are not palpable. On palpation, abdomen is soft, tender to touch. On suprapubic region, no mass or viscera are palpable. On percussion, there was resonant notes. On auscultation, bowel sounds are audible and no breath observed. This is the way you have to present your long case in the gynecological examination of patient. If you have any query, you can ask in comments. Thanks for watching.